All right, I'm going to go ahead and hop in. People will continue to join, but we'll just get them caught up. Good morning, everyone. Thanks so much for joining us for the kickoff session for our new training series. My name is Haley Bell. I'm the training program manager with Telehealth Rocks, and I'll be facilitating today's session. Like I said, as you join, we'd love to have you type your name and your organization in the chat. And we're really excited to have you here today for the launch of our new Echo-like training series, supporting the whole child, connecting brain health systems and practice. The series is built on a simple but powerful idea that no single system supports a child on its own. It takes all of us working in connection. So whether you're joining us from healthcare, education, behavioral health, or another role entirely, you are a part of that system, and we're really happy that you were able to join us today. Today's session is a WSCC framework for practice and collaboration. It'll really set the foundation for the rest of our series, and it's kind of where we begin to explore how the systems around a child and how family, school, community, and clinical care can work together more intentionally and effectively. Next slide, please. So before we jump in, I do just want to take a moment to kind of ground us in what the series is and what you can expect from it. So it's an ongoing twice monthly learning series designed to kind of build over time. And as I mentioned, it's grounded in the whole school, whole community, whole child framework, which gives us really just a shared way to think about how systems connect around children, which we'll get to hear a little bit more about later on today. We do want to make sure the sessions are interactive, so there will be kind of a case-based approach, and that's really just with the hope that we can create an environment that's not as focused on listening, but really an opportunity for all of us to come together and learn from one another. The series is also designed for multiple disciplines and perspectives. So you'll see today we have a child psychologist and an education specialist presenting, and we plan to carry this model throughout the remainder of the series. And finally, everything that we talk about in the series is focused on real-world practice and collaboration. So we really want to look at each topic and look at what it looks like in your day-to-day work or life. Next slide, please. I'm really excited to get to introduce today's speakers, both from our Telehealth Rocks team. So first we have Evelyn Nelson. Dr. Evelyn Nelson is a professor in the Department of Pediatrics at the University of Kansas and the executive director of Telehealth Rocks and the Heartland Telehealth Resource Center. She began at KU Medical Center after completing a pediatric psychology internship at the University of Miami-Jackson Memorial Hospital and graduated from the clinical psychology program at the University of Kansas. Evelyn has pioneered school-based telebehavioral health since 1999 and is an expert in child telebehavioral health. Evelyn's multi-state Telehealth Rocks initiative extends behavioral health practices and social service supports to support all students and set them up for success in classroom and in life. She's had the privilege to provide telepsychology services for over 25 years and energize the next generation of healthcare providers and researchers to partner with communities and leverage technologies to solve big problems together. We're super excited to have Evelyn with us today. We're also joined by Lori Crum. Dr. Lori Crum is the Training and Quality Improvement Director for Telehealth Rocks. She brings more than 2 decades of experience leading large-scale behavioral health workforce initiatives. And before joining KU Medical Center, she directed national training and technical assistance centers funded by the Substance Abuse and Mental Health Services Administration and helped to launch a global network of university-based centers advancing evidence-based addiction education. At Telehealth Rocks, Lori leads training and quality improvement efforts that connect educators, healthcare professionals, and community partners to improve access to care for children and families. She's passionate about building systems that connect science, policy, education, and service to set every child up for success in the classroom and in life. So together, between the two of them, they bring exactly that kind of integrated perspective that this series is all about, and we're super excited to have them today. Next slide, please. So before I hand it over, we do just want to do a quick look at kind of where we're headed today. So we'll start out with a welcome and series overview and then move into that WSCC framework kind of as a foundation for supporting the whole child. You'll hear more about how the series is designed and what you can expect as a participant. And then we'll move into a practice scenario and group discussion. So you'll have the chance to kind of engage with the ideas that we're talking about today. And then we will wrap up with time for questions and reflections. Next slide, please. And then before I hand it off to our speakers, I do just want to quickly review our learning objectives for the day. So by the end of the session, you should be able to describe what the whole school, whole community, whole child, or WSCC framework is and understand how it supports children's overall health and development. You'll also be able to identify how multiple systems, so education, healthcare, families, and community organizations, how all of those groups work together to support whole child outcomes. And we'll also explore how an interdisciplinary case-based learning approach can help you apply these concepts in a real-world settings. And finally, we'll walk through the structure of the overall ECHO series and how you can actively participate in the sessions, including those case discussions and peer learning. So with that, I'm going to go ahead and hand it over to Evelyn to get us started.
Haley, and welcome everyone. I really appreciate seeing everybody online on such a busy time of the year. With us kicking off this series, we're really looking at how do we support the whole child, and with that, where do we start? When we think about supporting children, it's really easy to focus on one setting. For myself, I'm in that far right-hand corner with health. So it's often, with our roles and what we're focused in on, it's easy to, focus just on that one area. And or even sub area. For me, of course, it's health and then mental health and then specialist and subspecialist, all that. So we're really trying to go from the granular and take more a wider view and look at all these areas that are impacting the child and the whole child. So school, health, family, and community. I think it's something we all know, but when we get into really busy days, it's easy to kind of lose sight of that big whole picture. It's kind of the idea that what happens at home affects everything that we see at school. What happens at school affects everything we see in the doctor's office or at home or in the broader community. The real challenge is that no single system gets the full picture. Um, and we all kind of know this, but it's just reminders as we're talking today that we really want to all come together across those silos and look at the whole picture. And it really then helps us connect better and helps each system work better when we get that bigger view. Doing this can feel really complex, and that's why we're talking today and trying to look at frameworks and models, because that can also be overwhelming as we're trying to look at the child within all of these systems. So, really, it brings us to the question that I imagine is why we all came together. How do we make sense of all this and all these systems in a way that helps us serve children better and families better, that really helps us put the pieces better to have the greatest impact. Next slide, please. So one framework that's done that is the whole school, whole community, whole child, or WIS framework. It's really a overarching framework that tries to bring all the systems together. The, the really good thing about WISC is it's also very driven by science and our best evidence. So, with each of these 10 domains that we'll talk about in a minute, each of them really goes to child health and child academic impact. So, it's really pulling it all together and using our best science. The model gives a shared way to see how the different systems around the child connect and interact. And in just a minute, we'll zoom in on each one of those that you see on the screen. We'll talk in a minute about the green and the things that go along with healthy children. We'll talk about the blue and those 10 components. And then finally, we'll talk about the yellow and talk about community. Surrounding the child are different areas that influence their development, things like health, relationship, environment, and learning. And again, what's really important with this model is it's not just the one thing, it's how they all fit together and interact. WISC really helps us move away from the siloed thinking and align across systems. It really helps us identify kind of where we're at and where we're all contributing together. Again, I know when I look at across some of the faces I know on the screen and new faces, we all are really touching different areas of this overall model, and it's a way to bring all that together. It helps us identify opportunities to strengthen connections and coordination. And today we're really looking at not really a deep dive into each one of the areas of WISC, but more really orienting us about a shared way of thinking. And as we then meet over time for the echo sessions, it's really something we can go back to and look at with that session, how does it fit into this bigger overall way of thinking? And again, really bring it all together to help children and families. Next slide, please. So again, we're going to talk through each element of the model. You'll see on the right top hand corner, it mirrors what you saw in that whisk frame. So it kind of shows you that graphic with the child and the green things around. And it's really the five whisk tenets. So it's really asking us what do children and students need to thrive. And the five things that are central to the WISC model are first, children being healthy, second, children being safe, really looking at those safe, secure environments. The third component is children and students being supported, and fourth, challenged, and then finally also being engaged. So healthy, safe, supported, challenged, and engaged. I think these align with other models that you may have heard about in our other Echo series. There's a lot of overlap, for example, with the relational health pieces that we've talked about over time. So, really looking at some of the safe, stable, nurturing relationships and environments that really aligns also with the five tenets that we find in WISC. They're meant to represent the optimal or best conditions for learning, development, and long term success. I think that piece is really important. It's not just the here and now, which are important, but it's the long term when we see that students and children are having these areas met. It really sets them up for long term success. Um, we also really are reminded some of Maslow's hierarchy of needs. The idea is that to be able to have healthy children ready to learn in school, we really need to meet the foundational needs first. And that really can help set up a child who's there ready to learn. Um, it's also a reminder that none of this is in isolation. As we've talked about in the earlier slide, it's really a combined effort. It's really all of us, schools, families, healthcare, communities, social service, and other really important areas in the child's life coming together, all being on the same page to advance these core things for the child. And again, really contributing together for the whole child's benefit. Next slide, please. Again, we're looking back at that WISC model. We see in that blue ring around, there's 10 different components that go along with the whole child. I'm going to talk, they kind of fall into different buckets. So this is a way of thinking about those different buckets to kind of help us remember the 10 components and the areas that really, again, help us set up students for success. So two of WISC components really around that academic content, and we've kind of lumped that together around the brain. So those are health education and physical education and physical activity. So it's really those areas that are around knowledge, skills, and decision-making capacity. And then the second component we've put around the heart, which is really kind of looking at services, things to do with care, responsiveness, and ongoing support. And the WISC components that fall under that heart domain are Sorry, I had a pop-up that was covering right where I was going to describe. The services we're looking at are counseling, psychological, and social services. A second one that's a WIS domain are the health services. A third is nutrition, environment, and services. And a fourth is employee wellness, kind of the idea that as the adults in the child life have wellness and do better, it really helps students do better too. A third area in WISC is environments. So it's really looking at the physical and social emotional environments, kind of that whole environment that the child is in, and being able to support those environments, then help with all of the other domains. And for that, you see, kind of we've symbolized that with a shield. And then the fourth area that WISC components fall under is partners. So this is a super important component. We see under partners family engagement and community involvement. Um, Really, those are so key to everything else that we're doing with WISC across academic conduct services and environments. And so, again, it's 10 really important components coming together to really provide that holistic approach. Next slide, please. And then we've talked about the inner and then kind of gone out and talked about the WISC components. Across all of it, we see that yellow outer ring. So the idea is community is that critical layer of support, and really focusing on schools not operating in isolation, schools as community and in community. Um, every student that comes to school is bringing that community with them as they come to school and as they leave school. And really focusing in on strong community connections to create the conditions for alignment across systems and impact. Um, Community as an active partner, we're really looking at several things that community brings. And again, I know we kind of know all these, but we're trying to put a name to them, so it helps us always kind of double check back and make sure community is included in everything we're doing. It helps us look at ways of resource sharing. So across all those domains, how can we resource share and work together? How can we offer direct services? How can we really reinforce all that community and families are doing together, and look for really opportunities for reciprocal relationships to really maximize impact? Um, what really matters is not just that these connections exist, it's how well they're aligned. We'll see here in a minute that WISC emphasized the importance of coordinating across all the things within community. And we'll see in a second that that includes policy processes and practices across sectors. And again, why it really matters is that it's to create this whole culture of wellness and everybody working together to advance things for the child. Um, so with this next slide, we're really looking at kind of that inner ring of the WISC model, and it's those policies, processes, and practice that kind of help us go from what we want to do to how we do it and how we work all together to do it. This is again that middle band that you see in the WISC model. Um, and connecting everything together. Um, we're really looking at what it helps break down with breaking down silos and then reinforcing things together in order to improve learning and improve health. I think with this one, we really are just emphasizing a lot of communication and coordination. And we'll have across the series of ECHO folks that we have presenting really talk to us about in their different areas of expertise, how they collaborated and develop processes and practices to go from what we think is good to actually putting it into practice. Next slide, please. And so you've probably noticed as we've gone through this series, we're leaning into a theme. You all are welcome to type the theme in. I'm sure that you noticed from the slide content what it is. We'll give everyone a second to type in. Or you can unmute. We're a small group too, so if someone wants to mute, that's all a-okay too. Yeah, right on. I know we didn't make it too hidden what our theme was. Um, I just want to say that was partly to make it fun, but what we're really trying to do when we're looking at 10 components and all of these other areas, it's really easy to forget some. So we're trying to put a story and something that kind of everyone's familiar with around the components, really to help me and help everyone else working together remember those many components. At the center, we've really thought about Dorothy as our student and our whole student, and really having those 10 around her. Um, we saw with the ripples on the pond the five core tenets in how we help Dorothy and really then every child thrive. We were thinking about the scarecrow as representing the areas of learning and academic growth. Um, the the heart components. The Tin Man is representing care, services, and supports. The Cowardly Lion helping us represent kind of safe and supportive environments. Toto really representing the trusted partnerships and relationships. Again, that can't be overstated how important that the trust is in making the whole system work. And then kind of surrounding it all, that gold area, the community, kind of thinking about that kind of like Glinda, and really having that overall overarching support of community. And finally, the yellow brick road for us, we were using it kind of as a metaphor to represent the path forward and kind of the how to and the ways to work together. Again, we may refer back to this as with the Echo series advances. It's really just a way to help us kind of remember all those important components. And with that, I'll pass it off to Lori. I know she has a lot of great information for us about what to expect today, but also with this whole series.
Thank you so much, Evelyn. We're going to shift a bit now. We've been focusing on the WISC model itself, and now we're going to talk about this learning series that we're launching today. We know that supporting the whole child requires coordination across systems, and that's one of the things that the WISC model really emphasizes. But we also know that doesn't happen automatically. Even when people are doing great work, like I'm sure all of you are doing, it can still feel, excuse me, disconnected. So it takes intentional structures to help people get connected, to communicate, and to learn from each other. And that's really what we're trying to build through this series. So let me just share a little bit about why we designed a regularly scheduled learning series as one of our intentional structures for connection and learning. As Evelyn has said, children's needs don't stay in one place. They ripple across systems. But most of the time, we're working in parallel. So the school is helping in one way. Maybe the pediatric practice is helping in another way. Maybe faith communities another way, but it's often in parallel. Um, and we're each doing our part, but it's not always connected. And traditional trainings don't really fix that. So a one-time webinar or a workshop or a presentation at a conference, they're kind of one-time things, and then everyone goes back to work as they have been for a long time. So instead, we wanted to create something ongoing, a way to connect people, perspectives, and practice over time. So we're so glad you're here today for the launch, and we really hope that you keep showing up. We know your time is valuable, and you won't be able to be here for every session, but we're intentionally trying to connect and have this kind of thread weave through all of the sessions, even if the topic areas change, so that you can come in as you're able and still feel like you're part of the community of learners. And because we really feel like that's what actually leads to change. So what will this look like? Sort of as Haley mentioned at the start of today's event, each session will start with a brief piece of content. So today we would talk to you about the WSCC model, just enough kind of to frame the topic. And we will make sure to highlight which of the WSCC components we're focusing on in each session so that you can start to see how they show up in real situations. And then we'll move on to a real world case or an exemplar case or a scenario. And most of our time will be spent in discussion, hearing different perspectives and thinking about what this looks like in your own role. So the goal is that you'll always leave with something practical that hopefully you can apply right away. Again, this isn't just about what happens in one session. It's really about what we can build together over time. So the goal here for us is to create a consistent space for connection and shared learning. And as we continue, we hope that relationships will strengthen or develop, and that especially interdisciplinary or cross-perspective, maybe educator and healthcare provider, or family member and social worker, or community leader and healthcare provider, those relationships will either get stronger or will emerge, or you'll meet new people by typing in the chat, by the discussions we have. And then that whole idea of this model of us all together supporting the whole child will bring clarity about how we can apply that in real world practice. So those small changes in how we think and work, they hopefully will start to add up to something bigger. And that's where we can start to see more systems level impact and ultimately better outcomes for kids. Okay, so that's the whole framework of what we're building here. And now we're going to switch into the scenario. As I mentioned, where we have the didactic or the kind of introducing a topic part of this series. And now we're going to switch into the scenario. So as you read through the scenario presented here, just start to notice what stands out to you. I imagine this scenario is something that you see regularly. I know I saw some middle school teachers introduce themselves in the chat. So you don't need to solve this right away. Just think about what you're seeing, what questions come up, and what might be going on beneath the surface. So we have a middle school student who's recently been frequently absent, visiting the nurse with headaches and stomach aches, struggling academically and less engaged in class. So here are discussion questions for today, and these questions are really meant just to guide our conversation. There's no right answer. We're really interested in hearing your different perspectives. So as you're thinking about this, consider again what stands out to you, what systems might be involved, and who else might need to be part of the conversation. And as we talk, you might start to see how different parts of the WSCC framework show up in this scenario. So we're a small group. I'd love for you either to raise your hand or come off of mute and just share what stands out to you in this scenario. You can also feel free to put it in the chat. Oh, thank you, Haley. Yeah, disengagement. Thanks, Lisa. Brad, please.
Hey, good morning, everyone. I think the thing that sticks out to me because in our work we support a lot of justice-involved youth, and that's that the attendance issues are oftentimes kind of the precursor to more significant justice involvement. So just being less engaged in class and having absent issues, I think would be a trigger to really start wrapping around this person and get a game plan going with a team.
Thanks, Brad. And I see some comments in the chat, not getting good enough sleep. I think that's really critical. We just did a sleep webinar last week. School social worker should be involved. Yes, social work could be critical here. Melissa is a social worker, so she's giving us what she would think about as her coming, from her perspective. If there's a recent change in the home, is this related to ICE concerns? Absolutely. So knowing what's going on kind of in modern day, in what's going on in the news and how that impacts our kids, reaching out to family, some sort of distress is occurring, wondering what goes on at home. Yeah, that's great. Thank you. So what systems might be influencing the student's experience? So we heard family system, maybe in the home environment. What other kind of systems might be involved? Social systems, friends, absolutely. Um, Having raised a daughter that those middle school years and the friend circle, that is the when we really see the mean girls arise, I feel like. Absolutely. The school system. Hormones, thank you. Yes, I was wondering if anybody would pick up on that. We're talking about a middle school age girl, lots of maybe health issues going on there that she's, just as a natural part of growing up. Online, yes. Thanks, Brad. And Brad is in our Digital Wellness Institute educator program. So thinking about how those online platforms and social media and just being online for long periods of time impact. Which areas of the WISC framework do you think might uh, be most relevant here? So I will go back just a minute to our WISC model. What part of that framework do you see showing up in this scenario? Oh my goodness, Haley is on it. The WISC components are in the chat. Yeah, health services, counseling, psych, family engagement, absolutely. So you see the Tin Man, the services. Feel free to also come off mute. We'd love to hear your voice. Are there other components that you might see as relevant to this scenario? Evelyn, you feel free to jump in too. You're the expert on the model.
Oh gosh, I wouldn't go that far, but I will say that what was going through my mind is just a student. Right now, we're all coming back from spring break. I know for some of us it's been more recent and some it's been farther away, but just the idea of change and, going from one time period to another, like how has that impacted? Um, also within the semesters, is it staring down finals or, is it a child who is doing real well in class but really is help hit a bump with learning or understanding as well.
Yeah, so if we go back to those 10 WISC components, you could see maybe there's some academic content that could be impacting. We already talked about services, the Tin Man. In when you were describing what systems might be impacted, you talked about the climate, the online environment, the school environment. Um, we might also think about the physical environment. Maybe they moved recently. Could be a child who is in foster care and has moved to a new bedroom or has to now share a bedroom. Um, and I heard you talk about partners as well. People said, I want to reach out to the family. I want to hear from the family what's going on. And I wonder about community involvement. You know, what is happening in that community? Someone shared about perhaps ICE is in the community and this child is that could impact their family. But maybe there's other things going on in the community. You know, we're in spring in the Midwest. We can think about what happens in spring, tornadoes and strong storms. So really looking at it from a holistic perspective. Let me go back to our discussion questions. Some of you have already been putting in the chat who else might be involved in supporting this system. Lisa mentioned having a trusted adult to do a daily check-in at school. I love that idea. Is there anyone else you think might be involved in supporting this student that we haven't mentioned already? Oh, Stacy, yes, allergies, spring season for some kids. I know that that is terrible. That my son has terrible allergies in the spring, and he often had struggles, especially in middle school when he was running cross. He tried to run cross country and ended up not being able to do it because of the path that they took through those grassy areas. His allergies just couldn't handle it. And how about you? What's one step you might take? So think about your role, your job today. If this was your student, or you saw or you heard about a colleague talking about this student, what might you do? Nice. Make myself available to her. I love that. Make contact. So building that relationship, initiating a conversation. I love that, Lisa. Yeah, school is not always the place where a student feels most comfortable. So where is that student thriving? And how do we tap into that? From those of you who have worked with middle school students, is this a common scenario? Yeah, I see shaking heads. Absolutely. So what are some ways that the people in where you're working are kind of problem solving and thinking about how to either prevent situations like this, prevent the kid from struggling, or to think about new and innovative ways to address the scenario? I'd love to, even if you have a specific example, part of our work here together is learning from each other. Maybe your school or your community organization is doing something that another group could learn from.
I can share, Lori. One of
Thanks,
the
Brad.
things that I've seen work the best in working with students with either a disability diagnosis or a mental health challenge, especially, or an emotional disturbance category potentially, is having that contact with the school to do a simple check-in, check-out process. Because a lot of times, if the student has someone that they trust in a school environment that they can hang out with right when they get to school and say, and the person says, hey, here's what we have planned for the day. Here's kind of what to expect. That sets that clear expectation. And then at the end of the day, they can also say, okay, so what homework are you working on tonight? What's our plan for tomorrow? And we've seen that be really effective just to have that trusted relationship at the beginning and end of the day.
Yeah, I think I really like that idea of having the kid know that there will be a consistent check-in with them. Thanks, Brad. Stacy, I see your hands up.
Yes, I was just going to say I did work in a middle school for 9 years, and we had a care team. So I was a school nurse. We had a care team that we met either biweekly or at least once a month to have, we had kids that were on the radar that we noticed attendance issues with that I was seeing frequently with things like headaches and stomach aches, because that's probably the two most common complaints in middle school kids. Kids that were less engaged, and just kind of that collaborative effort to talk about, well, what are you seeing? Are they struggling in class? There was a teacher included as well, just to kind of get that big picture perspective and try to pinpoint exactly what the problem is.
Thanks, Stacy. I think maybe that's similar to another Stacy wrote in the chat, spelled differently. Um, as she says, my CST is really good about talking about all kids that we are concerned about and assigning someone to check in. Stacy, do you want to share more? Stacy with a Y.
Um, yeah, my CST meets weekly, and
And will you just say what CST stands for in case there's some
I'm
folks?
sorry, child study team. And it's really supposed to be more focused on special ed kids, but I think we take in we talk about all students that we have concerns about and try to assign someone to check in and see what's needed there, if the school can help.
Thanks, Stacy. That's great. And Renee, can you talk a little bit more about this form that you have a student fill out?
Yeah, this particular boy isn't very good about verbalizing his frustrations or what's going on. So the teachers got together and kind of put a form together that he was comfortable with. He was part of filling or getting this form ready. And then he can just mark throughout the day how he's feeling, what's going on in his head. And then at the end of the day, he goes to his person. They review it. They talk about what how he could have handled it differently, what else was going on in the room that made him feel the way he did. So it was just a form that everybody came up with the child included in that decision making.
I love that the child was part of building that form. And that really makes me think about how you are helping him kind of build metacognition skills. So thinking about what he's thinking about by filling out that form across the day and noticing how what's impacting his thoughts and feelings. So that's really powerful. I love that idea. Um, and I love that then there's some accountability built in because he has to bring the form to his person at the end of the day and kind of they have an opportunity to discuss it together. That's really creative. Thank you for sharing that. Does anyone else use that kind of, um, I guess what another observation I have about that is I think it's very insightful that not every child wants to verbalize. So we've talked a lot about having an individual, a trusted adult, check in with the person. I think many times that is a verbal check in. Come to my office, let's have a conversation. Um, Maybe a phone call. And maybe that isn't the way all kids would want to communicate. So are there other ways that you're using to reach out to kids other than having kind of verbal conversations with them? Do any of your school's online platforms allow for that kind of private messaging or anything like that? Stacy, with two E's, Stacy.
Yes. So I was just going to say, kind of along those same lines, we also had what we called the responsibility room in the middle school where that came up in place of ISS. And
Mm,
so part of the kids sitting in that responsibility room space was them filling out what they called a think sheet. And that allowed them to kind of process through what, what is their headspace, what happened, what could they do differently kind of thing while they were sitting in there. So I thought that was a really good concept. Being in the nurse's office, I don't really know what the outcome of that was, but I thought that was good for the reasons you were saying. If those kids weren't able to verbalize what was happening, that they could write it down, and it gave them the opportunity to process through it on their own versus somebody just telling them what they did wrong and what they should do better.
hmm Absolutely. I think, writing certainly is a very strong way to process thoughts and emotions. Talking is another way. And I wonder if we can think about, are there other strategies that maybe are similar to platforms that kids engage in today? I'm not saying I know what that looks like, but, we are in the TikTok era. So, I wonder if there are other ways to get kids to process their emotions and communicate what might be going on with them that we could think about over time. Stacey with a Y says some students email me or use Teams to communicate. Yeah, thank you for that. Well, great. I'm going to wrap up our scenario today. I hope you saw kind of we are practicing here what this series will look like. So, thinking about how we support a whole child, what are some strategies, what are the systems that are working together. Our practice scenario today was a composite scenario of experiences that we've had in the past. In the future, we may have case presenters who provide a real life scenario. We might have someone describe a scenario that someone else has shared with them. It could be about more of a specific topic and not such a broad area. We're really trying to make this a flexible environment that we can bring lots of different discussion points to the table and really cover the whole WSCC model. Evelyn, is there anything else you want to share about that?
I think just the part of the goal is for everyone to be able to share what's working. I think sometimes, especially we're fortunate to have folks coming from broad geographies, rural areas. So, kind of hearing and really learning from what you see working in your own schools, so we're not reinventing the wheel.
Yeah, absolutely. We know you all are so brilliant and you're coming up with great ideas and you're testing it out and finding success. And we're really hoping to kind of pull the sheet back from those successes that are happening in real time on the ground and share them amongst each other so that we can all learn together.
It looks like we had a question, and I just want to say we will share the slides, and if there's any other resources that are useful, we'll share, or please get in touch if there's other things we can help you with resources.
Oh yeah, and I will put my email here. Oh, thanks. Haley is on it. You can go ahead and email our email address there, and we can certainly talk to you about professional development opportunities. So as we wrap up, I just want to highlight kind of a few takeaways from today. We're calling it our ripples. So what we hope you will, like a ripple in a pond, share out with your colleagues and just ripple out in even your own thinking across the work today. If you're like me, you may drive home later and get an idea that is sparked from this session, or in a conversation with a colleague during your lunch break, if you get a lunch break. Something that might come out from having participated. So our ripples are really that supporting the whole child really does require connected systems. The WSCC framework gives us a shared way to understand and respond to all the complex systems and domains that are intersecting in a child's life. And learning together across disciplines. I heard school nurse, we have social workers, we have teachers, we have others, kind of program managers and administrators, all on this call together. So if we learn together, we can strengthen what we all do in our practice. And really, a key message is that even small shifts can create meaningful impact over time. So I'll now turn it over to Haley to preview what's coming next.
Yeah, thank you so much. Before we kind of start that, I just want to say thank you so much to Evelyn and Lori for sharing their expertise today, especially walking us through that WSCC framework and kind of helping us all get better acquainted with the new learning series. I also want to thank you all for your engagement in the chat and coming off. It's really nice to share, different strategies that are working for you in your schools and communities. So yeah, we want to highlight our next session in the series. This is going to take place on Thursday, April 30th at 12 p.m. Central. Our topic for that session is supporting youth substance use prevention and early intervention in schools and communities. So in that session, it will be kind of a similar setup, very interactive, and participants will kind of explore practical approaches to early identification and intervention. Really, again, with a focus on real world implementation in different schools and community settings. So yeah, we'll hope you will join us. It'll be Carolyn Swinson and Hildy Cohen, and they will take a deeper dive into that topic and continue building on what we started today. Next slide, please. And then obviously, thank you again for registering and being a part of the series. We're super glad that you're here. And as a part of that, we'd love to get your feedback on today's session. So if you could please scan the QR code that's on the screen, or I just dropped a link in the chat. It's just going to take you to a brief post-session survey. This is really your opportunity to share your thoughts and experiences with the session. Your feedback really does help us to shape and kind of improve our trainings, especially with this being a new series. We really want your input to make sure that it's a meaningful and valuable time for you all. The survey link will also be included in a follow-up email. So if you can't grab it here, you will see it there as well. In that email, you can also expect to receive a copy of the slides, additional resources, and a link to the recording. And then you will also receive a certificate of attendance for the session. So please just give us a little bit of time to get those processed, and they'll be in your inbox. Yeah, thank you all again for taking the time to join us. We really appreciate your time, and we look forward to seeing you at that next session on April 30th. Thank you.